into page 129. Welcome to blood hanging. Okay? Page 129. I want you to put NCLEX on that chart. NCLEX. If you are donor A, you can give blood to A and AB. If you are B, you can give blood to B and AB. If you are AB, you can give to AB. And if you an O, you can give to everybody.
Universal.
Okay? Page 130. IV therapy. Why do we give IV? The reason we give IV fluid medication by IV is so the medication can go to the body quicker. RN, once you become an RN, you are already IV certified. You can say, Miss Sonia, can I go somewhere where they can teach me the correct way how to put IV? Yes, but you don't say, where can I go to become IV certified? That means you don't know the worth of your license. Once you are an RN, you are IV certified. Once you are PN, you are not IV certified. You have to go become IV certified. PN do not administer medication IV unless you're IV certified. Now, when we put in IV, or when the doctor sent us to collect blood, we will use a butterfly. We will use a butterfly to collect blood. I'm on number 2C. Butterfly mostly commonly used in children, older clients, and people who are immune compromised or fragile. When we put in IV, we don't put the needle in you. We put the cannula in you. The cannula is made of plastic. So you can become latex allergy. If you're latex allergy, excuse me, you must let us know that. Okay? Now, then we go to IV gauges. I'm on page 130B. There is a diamond. IV gauges is the smaller, right? The smaller the gauge is, the bigger the line is. For example, for you to get blood, you need 18, 20, 16, right? If I'm only giving you IV, I can put a 22, a 24. The bigger, the smaller. Any question, you must know cannulas and you must know gauges. Who get big gauges? You giving blood. You are a burn patient. The patient came in burn. You put big gauges in them, right? An older person, you put small. When you administer the IV come with a line. The IV come with a line. Look the picture on page 131. You see the IV pole? You see a primary bag and you see a secondary bag. The primary bag is the IV fluid. The secondary bag is the antibiotics. They call the secondary bag a piggyback, right? Piggyback. That is the secondary right here. Now, this is the line. Now, the line is to be changed every 24 hours. The line is to be changed if you are feeding, if you're giving food, it's every 24 hours. If you are giving fluid, it's every 72 hours. The dressing is to be changed every 72 hours. Okay? Now, then we go into 131, number 3. Anytime you get in fluid, you must let us know if you're allergic to latex, because the IV tubing is made of plastic, right? So you want to make sure that. Then NCLEX asks you, where do you put in IV? And here it is. You're going to watch, right? Okay. When you put in IV, right, the first thing you must do is find the landmark. The landmark is where you're going to put the IV. The landmark, you see? This is always a landmark. This is always a landmark. If I want to put in an IV, I want to go either here, right? So if you can't see, stand up. Okay? So back up. I'm a little bit. No, you got really good veins. Wow, look at her veins. They're popping up. You see the vein? Wow. The vein, she's like the best patient. Why? I don't even have to put a tourniquet on her. Me venio. You see, if you touch it, it's spongy. You push, it push back. That's a vein. We do not put IV in arteries. We put it in vein. So in her case, she don't need a tourniquet. The purpose of the tourniquet, so this can pop up. If hers is so good, I don't need a tourniquet. So I'm ready to put in her IV. I don't need a landmark because I see it. You see? Got it. What? See, look. It's nice. So I will do, look, if she didn't have this, I will put a tourniquet and I'll tell her to pump. Wet. Look. You see it? You see how they pop up? So I tell her, she pump. I have her tourniquet in. I'm a nurse. I like to hold patient tight. And I get my needle. And you never take the needle and go in the vein. You go with the needle and you don't put IV down this way. IV always go up. So you take the vein and you take the needle, and all I taught the skin, taught me la lei. Some ka was been not good. Et puis montre comme ça, regardez. Look, I go in it. You see? In it. Right in it. Boop. And I will see blood come out. Boop. I will remove the tourniquet. I will press on it. Put my little bottom piece. Put a little tape. I'm in. While she's there, I will take my tube and I will pull just to make sure I'm in, right? Once I'm in, I will flush. The IV is in. Guys, you don't leave the needle in her. You use the needle to put the cannula in. And the IV's in. If you an RN, you don't know how to put an IV, you ain't gonna get no job. If you live in Broward County and you go to North Broward, which is Broward General, North Broward, Imperial Point, Coral Springs, you gotta go do an IV right away. IV. 4 new nurses. You don't know how to put an IV, bye. Next, because there's so many people looking for jobs. And we wean out. And if you do not know how to put an IV, and it's okay, but the nurses used to call me, son, you can put an IV. for me, because I'm an ER nurse, I'll go. People don't say nothing. Like, I don't care. I go and do it. But when you you don't know how to put an IV, you a nurse. Like, I do it for the Haitian nurses, but the white girls, oh my God, where did she go to school? They say stuff like that. How to put it, so you must know how to put an IV. Now let's go. Where is the IV put? Ready? Let's go. Vein, right? In the vein. Lower extremities, let me explain to you. Lower extremities are normally used for infants or older people. Let me explain something to you. They will put the IV for you in the lower extremities. However, you are at risk for DVT. For infants, we will put it in the scap and 131C, peripheral IV site. Older people, kids will put it in the scap and we'll put it in the feet. Children too. Who will we put an IV in the scalp and the feet and right here? Burn patient, AIDS. AIDS patient is so chaotic, a med, that we put it, guys, either in the head or the feet. I see it to a med, right? So when you put it here or here, the feet there is for DVT. Here, there is for infection. Who will put IV here? ER nurse. ER nurse. Trained people. Floor nurse, med surg don't know how to do it. If they know how to put an IV. Okay? All right. Now, page 132, box 13-1. You're going to put NCLEX. Where would you not put an IV? Where would you not put an IV? Ready? Let's go. Edematous extremity, a weak arm, a patient who had a mastectomy, a patient who have a shunt, a patient who have a shunt, or a patient who have a fistula for dialysis. You will not, if I have a shunt here, you will not come with your IV. Okay? A patient who the area is infected, like for example, I got radiation, you don't put it here. Make sure you know that for NCLEX. The next section, administrating IV solution. IV, RN, give IV medication. Ready? They go to all that apply. The IV solution should be checked against the physician order. You must wash hands. You must, when preparing a new solution, clamp it. You must remove air. You must not let the IV line touch the floor. Change the IV tubing if it's food every 24 hours. If it's liquid, normal saline, every 72 hours. Change the IV dressing every 72 hours. Any question? You with me? Now, number 7, you're going to make a little note. I cannot go to open piercing door without knowing these. What can go wrong when you put in an IV? What can go wrong? The first complication that can happen is called phlebitis. What is phlebitis? When you put in the IV, you put it in the wrong vein or you put the needle wrong, the patient have DVT or bull. What a lump. What is your initial nursing intervention? Ready? Stop it. Remove it. Put warm and then call the doctor. That is called phlebitis. Stop. Remove. Put warm. Call doctor. The second complication that can happen is called infiltration, which is extravasation, which means when you put the medication seeps out. Seeps out means médicament coulé, come out, which like chemo, the patient is getting chemo, the chemo seeps out. When you have that, you're going to stop, remove, call the doctor. Did y'all hear that?
Yeah.
Stop, remove, call the doctor. Did I say go put something on?
No.
The doctor going to tell you, should you put hot or cold? So there's a difference between phlebitis sebul, infiltration is the drug come out. This patient you're going to see first because the patient can lose the arm compartment syndrome. Another complication of IV is called fluid overload. Anytime you give IV fluid, guys, you must assess my lungs. You must assess my lungs. Why would you assess my lungs? Because the fluid may be going into the lungs and the patient may have crackles. Anytime you give him IV fluid, you see the patient blood pressure drop. You will stop it, reposition the patient. When you give me IV fluid, you see the patient blood pressure go up. That tells you you're pushing it too fast. For example, doctor ordered for me to give a fluid 100 cc. I don't start 100 cc, no. I start 30, 40, and then I eventually go to 100. Parce que si mba li trop vite, manger a haute l'eau a kay nan lungs. If it goes too fast, it may be in the lungs. That's why IV patients who have IV fluid, you must assess the lung, you must weigh them daily, and check blood pressure. Yes?
What happens when we have it on bolus?
Bolus. Anytime the doctor asks you to bolus a patient, a bolus means give it to him as fast as possible. When a doctor asks to do something in bolus is because sometimes the patient blood pressure so low, be quiet. Sometimes the patient blood pressure so low, the doctor say, bolus kawal. That means I want you to run it as fast as possible. If it's bolus, they will tell you. Let me tell you, if it's bolus, you don't put it on the pump. You don't put it in the pump. You put it as you may take right now, you let it go. You don't put it in the little timer. You just put it up, let it hang. Open it, let it hang. Because that was ordered. And sometimes a patient have ectopic pregnancy, going into shock, doctor tell you to bolus the patient. No. IV push is I'm taking a needle and I'm going. Ma pousse. Pump, bolus means I take the water, put on the pump, just keep one English. Listen, if IV push is no pump. I just take the syringe out, push. That's it. Bolus means I take it. See, the pump has like a little control. I don't use that. I put it in, put it inside, and let it run.
What's the difference between the drugs? Like, what do you do for the IV push?
Okay. When a patient has sickle cell crisis, and the patient say, "Oh, I have pain, I have pain," the doctor may say, "IV push morphine, and then put morphine on the pump, titrate it." That means slow. If you body on bolus, a push, then I give to him tech, to get it in the body quicker, faster.
Miss Sonia,
Yes.
do you have to wait for the doctor or just for the police if you assess?
Yeah. Oh, yes. Ooh.
If you assess BP,
Okay.
is so low, you have
Okay,
to wait.
listen, good question. Let me tell you something. Anytime you assess BP so low and you work on third floor, you med-surg nurse, if that patient can drink, you go give him a big cup of water. Because if you go bolus without an order, not long patient, the patient can go into what we call SIADH. So you don't go bolus without no order. Oh, you don't go bolus, nothing. Patient can drink, but don't be low. Patient can drink, give me water. All right? Bolus is a stat order right away. Okay? Now, air embolism. When you put an IV, we're going to see air is bubbles. You got to remove all the bubbles. And you nurse say, but we wasting all the medication. So what? You can, yes, you may waste all the medication. It's okay. Air get in the lungs, I can die of what? Air embolism or pulmonary embolism. All right? Any question? Now, RN, this is why you pay your $900. There you go. Central line, very big on NCLEX. The PIC line, they call it central line. Okay, why do I get a central line? Is central line said for monkey get chemo, dialysis, right? So look, guys, the doctor put a PIC line. They call it central line. Central line has PIC line, right? Has one vein, but 3 ports. One, the top is blue, right? One, the top is red, right? And the top is green. All right, we're going to say green here. The doctor says, Sonia, I need you to go collect blood from Mary. Who can do this? RN. Why? Because LPN do not flush. Don't say I'm IV certified. NCLEX don't know you IV certified. If that's the case, CNA can be médicament because CNA are med tech. Now, this is called a PIC line. 3 ports, 1 vein. So doctors say, go collect 3 tubes of blood from Mary. I go in the room, I introduce myself to Mary. True? Wash my hand. It's time for me to collect the blood. You only supposed to collect blood with the red port. So I go in. The first thing I'm going to do flush 10 cc, 10 cc, 10 cc, normal saline. Although I'm using this, I'm still going to flush all three. Any question? Parce qu'ils sont seul vein. 3 port, 1 vein. Here it is. After I flush all three, I remove the first 10 cc of blood. I must throw that away. I remove the first 10 cc, remove it, jeter. Now I have to go collect blood from it. Take my needle, take the top of the needle off, take my blood. Fill my container, throw this needle away. Go get another needle, take blood again, fill the second container, throw the needle away. Third container, take my needle, take the blood, fill my container, throw it away. Now, all my containers are filled. I label Marie-Pierre, Marie-Pierre. Now, I label. I'm done. Now, I have to flush. Here it is. I went in with 10. I go out with 20. 20, 20, 20. So the way NCLEX put it, they don't put 20. They put flush with 60. You never take it. That's the answer. What's 20 times 3? 60. So, yo pa mette 20. They put 60 and you don't take it. When I went to get the blood, I flushed with what? 30. I put 10, 10, 10. Now I'm done. I flush with 60. 20, 20, 20. But instead of them putting 20, they put 60. And you don't take it.
Miss Sonia. But,
Yeah.
But since you're flushing, so is the question's gonna tell you, how should I say it? Like, since you're gonna flush with 10, you're gonna go out with 20, but then what?
The question's going to ask you, you are collecting blood. Put it in order, the procedure. Put in order. They're going to put flush with 60. I've had several students with that 60, Florida. And the students never take it because they say 60. You don't flush with 60. The hell you don't. 20 times 3.
So it's kind of like a
Multiple drag and drop.
Okay.
For the PIC line. Or another word, they put central line. Now, so that is collecting blood. Now, then they ask you how to change the dressing of a central line. Stay with me. Look, when you changing the dressing, the patient never lie down. The patient sit, so the dress, let's say the PIC line here. Let's say here. The patient turn. You, the nurse, will wear gown, glove, mask. NCLEX would do the patient wear mask? No, the patient just cannot talk because if the patient talk, sneeze, they're gonna infect here. So look, I'm changing dressing. Patient turn, you here. When you remove the dressing, you remove it with regular glove. When you finish, take it off. When you put the dressing, you're going to use sterile glove. This is where they're going to ask you about the sterile field, which is a skill in your book. You're going to know how to do the sterile field, how to put the sterile glove to open the sterile field. When you remove the dressing, you're going to always use regular glove. Parce que when you put sterile dressing for the étoile, you remember you clean it with Benadine, right? And the patient turn, no talking, and you will wear a gown, glove, mask, and so forth. Any question? Yes.
When you take the regular glove out, you don't need to wash your hands before you take the...
No. When you take the dressing off, when you take the old dressing off, you don't need to wash your hand. You can use sanitizer and then put in your sterile. You got to open the sterile field because it's in the sterile field, the sterile glove. And you remember you cannot move your hip because if you turn, you what? Yes, the sterile field. And anytime you break the sterile field, you got to throw it away and start all over. You move this on l'école right? In clinical, they teach it. Hey, listen, I see a lot of you guys sweating. All this is in your skill book and it's on your skill sheet. Your skill sheet says sterile field. This is what I'm talking about. So you get your skill book and you look to see the sterile field. That's it. They do it with you. Okay? Now, blood hanging. Right? Our last section. RN, you need to go in the skill book. Put it in order. Page 743. That's the skill book. How to hang the blood. PN, you do not hang the blood. You don't even witness the blood. But you must know after a patient receives blood, what can go wrong. You got me? Let's talk about the blood hanging. RN. I'm going to go on the board and I'm going to put the steps. Okay? 743. Okay? Okay. Why do the doctor order blood? The doctor order blood when your hemoglobin is less than 7. So if blood is ordered in units, so we'll say this is 400 cc. If Coward received blood before, because blood, we got 4 hours to run it. If Coward received blood before, she a sickle cell patient, she get blood every 3 days, right? We're going to run 200, right? So we're going to run this 400 cc in 2 hours. Who did not understand that? The 1 unit has 400 cc in it. So si Kawol prend 100 déjà. Now we're going to run this blood in 2 hours. Descend, nous fini. 200 cc per hour. 200 1 hour, 200 the next hour. So we're going to run this blood in 2 hours. Total of 400.
How much one unit has?
Huh? 1 unit can equal 400 cc, or some units can, North Broward, have 1 unit, 400 cc. Some places, 1 unit can be 500 cc. It depends on the hospital. Blood bank. Now, if Kawal never received blood before, We're gonna do 1 hour, 1 hour, 1 hour, 1 hour. So we're gonna hang this blood in 4 hours. Any question? Now, here is where NCLEX get you. For every unit of blood I give you, your hemoglobin should go up 2 points. So seems set by 1 unit. Your hemoglobin should be 9. Any question? We cool. Now, the doctor ordered the blood. The first thing the nurse needs to do is go look at the order. So number 1, order. Number 2, go get the normal saline. It is understood that you run blood with normal saline. If you call the doctor for an order of normal saline, after he cuss you out, la vosalo bad, he gonna send you somewhere and call the supervisor. It's like me saying, go brush your teeth, and you say, where's the water? It is understood that when you hang blood, you hang it with normal saline. Why, Miss Sonia? Parce que normal saline, I'm saying encore, c'est de l'eau sel. Ou besoin pour venir ouvert, de l'eau sel. Don't you know when you don't feel good, people say, go to the beach. Take all your clothes off, go to the beach, quitter de l'eau sel là. That's what normal saline is, salt, water. The purpose of the normal saline to open the vein, dilate the vein. So that is why. So I go to the Pyxis, I get normal saline, 500 cc, not the big bag. And then I go in the room. I remove all medication on the pole. Everything, antibiotic, whatever was running, I take off.
To put back after?
No, you can put back after, but put them away. Remove everything. You can put it in a drawer, I don't care where you put it. Okay? Now, you run the normal saline in a tube called Y tubing. Let me explain to you. Y tubing is the tube that the patient get the blood. They call it Y because it's shaped like a Y. Yeah, you need me? Malaine, L-A-I-N-E.
Marie Rose.
Is a Marie. She probably
New
left.
student?
A Marie Lane. You got her number? I'm going to sign it for her. It's a check, Miss. No, we'll keep it for next week, Miss Carrie.
All right.
Okay, she probably went home. So normal saline, guys, we look, this is important. We open this and we lock this. We open this so the normal saline running. We clean the room, right? We call Chiquita, the CNA, and we say, can you do a set of vitals for me? The CNA. She go in the room, she do a set of vitals. You now take the set of vitals that Chiquita gave you, you let the normal saline run, and you go get the blood from the blood bank. You do not send CNA. I send them. You don't send CNA to go get blood. You don't walk in the hallway of the hospital with blood. It got to be in a plastic bag. Some facility don't want you to walk in the hallway with glove. Some people will bring a glove. That's the only time. Right? I hate looking at blood, so I will bring a little towel with me to put it in the Ziploc bag and I'll carry it. m'couvrir. I don't like looking at blood. So I will bring it to the floor. Here it is. When I get to the floor, now I'm at the floor with the blood, I go find me a witness, the nurse, Kawali. I get a witness, which is an RN. And I say, can you please witness blood with me? The first thing she's going to ask me, can I see the order? Now, she sees the order. The blood is in my hand. I give her the paper that came with the blood. Did y'all see that? The blood is in whose hand? My hand. I give her the paper that came from the blood bank. So me and her go in the room together. Here's what NCLEX get you. Although me and her go in the room together, we don't work together. I have the blood in my hand over here. She have the paper with the patient. While she talking to the patient, I have no right to interrupt. She's checking the blood paper against the patient. She don't go, are you Bobby Brown? She say, tell me your name. She checking. That's paper with patient. Sonia is over here with the blood. When she finish, she's going to check with me, away from the patient, blood with paper. 2, she checked twice, paper with patient, blood with paper. She's going to sign. Boo, 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 boo. She signed. Now, I'm going to hang the blood. So, now I'm ready to hang the blood. I will stop normal saline, meaning I lock it. I spike my blood, and I run the I run the blood. So now I run the blood. Right? As soon as I see the blood get in her body, I do a set of vitals. And what? You see, I do this vital, not the CNA. And while I run the blood, I do vitals, and I assess, and I stay with her for 15 minutes. If there's no reaction, every hour I let the CNA go do the vitals. If she never took blood before, you remember I'm doing it 1 cc per hour. If she took blood before, I'm going to do 200. Okay? African Americans, when you hanging blood on them, especially Haitian, they don't like to see the blood. They ask you to clean the room. They cover the blood, no food, no nothing. White people, can you go get me a chicken sandwich while they hanging the blood up? But it depends, right? So you hang the blood. You stay with the patient. Now, here's where NCLEX get PN and RN. They ask you, while you hanging the blood, what can go wrong? And this is where they get you. I'm white, she black. I'm from Australia, she from whatever, Haiti. We don't even know each other, but we're matched. Isn't it fair that when she takes my blood, she will itch a little bit? Why you say stop blood or do that? You will always itch a little bit. It's not your, hell, we not even the same race. Hell, you don't know me, I don't know you, our blood just match. And I'm a blood donor. It is normal every time somebody have blood, they get a little itch. That's why the doctor ordered Benadryl. You don't go stop no blood. When do you stop back pain, stomach ache, sweating? I cannot breathe. My back hurt. Now you stop. Run normoxylene pour laver. Call the doctor. When you stop the blood, you got to take the blood. You got to date it, time it. The reaction, you got to document and send it right back to the blood bank. And you must call the doctor. Anytime a patient getting blood, I need 2 consent from you. Consent for you to come to the facility and a consent to hang the blood. We don't use the same consent. Carol come with chest pain and Carol got 1 consent, we go give blood. No. We need a consent for the chest pain and a consent to hang blood. Now, sometimes when you hang blood, right, the patient may have something called delayed reaction. You had a baby in 2000, still 2005, you have a reaction. And that is a medical emergency. So NCLEX gets you like this. There's 4 patients. Which patient you going to see first? The COPD or the patient who had blood 2 years ago? Do you know you guys never take the blood 2 years ago? You know what students say? Oh, it's too long. Look what the book say. Delayed reaction occurs days to years. 135, transfusion reaction. Everything I just did is from page 135, from C all the way to D. That was on your NCLEX question. Any question? C and D. And RN, where you gonna go hang the blood, put in order? Page 743 in your skill book. 743, I want you to get you a little flashcard. Method number 1, number 2, number 3, number 4, put in order because this is on the people test. RN, you don't hang no, PN, you don't go hang no blood, no. However, you must know what to do after any question.
Can you refuse to be a witness of that?
Yes, you can refuse, but listen, you refuse for me, you can refuse, but I'll go get another nurse. But however, don't ask me for nothing.
It's going to come.
Okay? Any question? Now, yes, ma'am.
Sonia, when you say never have blood before when you do it for 200.
Okay, Dundee. You have 4 hours to hang the blood. Dundee. Si moun nan pran san deja, son moun se chaque semaine ya bay san, body can tolerate it. So if I have 400 cc, to hang my body 200 1 hour, 200 another hour. Because my bay 400 in 2 hours. But si madame sa pa jam pran san, kote m kay bay 200, si koy she might not tolerate it. So I will give her 100 1 hour, 100 1 hour, 100 1 hour, 100. Now let me explain to you now. When you don't hang the blood in 15 minutes, the blood lice. Lice means the blood break apart. Even bull. If I hang it, I put her at risk for potassium, high potassium. That's why you got 15 minutes to hang the blood from the time I come from blood bank to the patient.
But when you say never, or if she has it for the first,
Is it for your first?
hospitalization or
No, she'll.
like 2 years?
No, listen. If I say, Kawan, have you ever had blood before? And she said that's her first time. Kote mkabali 100, 200, too much. She may go into fluid overload. That's why sometimes after each unit of blood, the doctor order Lasix to remove the what? The water. That's why every time you hang blood, you must assess the what? You got it?
Yes, thank you.
Okay, any question? Shh. Okay, write on your calendar. Look. Calendar. Shh. Next week, Wednesday, we will do eye and ear drugs. And you know, eye and ear drugs, and I'm gonna do neuro again because there's people only come for that, and I'm gonna do skin peds, and peds will be done. Next week, peds going to be done. Thursday, and next week we will have test taking strategy. Thursday, we will do eye and ear disease. And then we will do pre-op, post-op, fundamentals. So it looked like it's got the fundamentals, med-surg drugs, we back on the calendar. And we got specialty. Your peds test will be September 3rd. I give a week. Yeah. 10. Because I give you a week. Yes.
So now 10.
I will give you a week, because I do it for every class, give them a week to study. So your PEDS test will be September 10th. If you feel you want to take it early, you can.
Okay.
If you feel you want to take it early, you can. If you feel, now listen, if you, see, that's how we don't listen. If you took a psych, you failed, you will not be taking a PEDS. If you took an OB, you failed, you will not be taking a PEDS. So know where you are. If you knew, you know this is your first test. Now remember, when you take your test, if you are a new student, you got to make sure you have your full payment. If you are old student, in order for you to take my test, you got to be zero balance. Do we make myself clear?
Yes, Miss.
All right, because I don't want nobody, everybody who I spoke to, you know your calendar. I spoke to Miss Carey. I spoke to the Orlando people. The school gonna send me 5 people because I had to allow some of the students to stay because I'm behind. Instead of them sending me the whole 25, I'm gonna take 5 a week. 5 a week, because next week I'm gonna finish this so the people that are approved to stay 1 more week, you can come and we have enough seats for 5 people. Again, any question, don't come up here sideways with me. I'm alert, oriented, I'm 50. I run a very organized business, tight.